سوا على الهوا سوا على طول سوا على الهوا ياتيكم عبر أثير إذاعة
صباح الخير أمريكا
من يوم اللي اتكون يا وطني الموج كنا سوا.
Good morning and thank you for being with us. This is Khalil Hassan, editor of IVFMichigan.com, the fastest growing business digital magazine in the Middle Eastern communities in Michigan. Hope you are doing well on this cold day. I think this is the first day that I see snow outside, and it's not a lot of snow, but it's just the first snow we see, slivers of snow outside. So be careful driving. It's cold, and they say it's 34 degrees, but I think it feels a little bit colder than that. It's going to reach or hover in the mid-40s today. So be careful when you're driving on the road. Just want to thank you. Mike, has Dr. Shamma joined us?
Yeah, he's on.
Okay, thank you so much. And I want to say good morning to Mike, is a producer, and good morning to all of you.
Sorry, he just dropped.
Okay, I'll be back. And we're going to be talking to Dr. Nicholas Shamma today, and we're going to be talking about third-party donations, specifically concerning reproduction and concerning if some of those of you, that are ready to have a child, to conceive, what some of the complications for third-party donations. Again, it's cold, and then the other issues that we're going to ask Dr. Shamma to help us with is an update on the coronavirus. Good morning, Dr. Shamma.
Good morning to you, Khalil, and good morning to all your listeners on this sort of icy morning. I mean, for all the listeners that are driving, I just drove from Ann Arbor to Bloomfield Hills, and I'm still on the road. I mean, the roads are pretty icy, and there's at least on M14 a lot of accidents and spin-outs.
Be careful.
So
yeah.
So just be careful, everybody driving.
Yeah. How long is it going to take you to get to the office?
Well, it's going to be a while because of the traffic. I was ahead of schedule.
Yeah.
Now I'm behind schedule.
Yeah.
But anyway, I'm in the
Absolutely.
car.
Yeah. Well, drive safely, and we thank you for taking the time to be with us. We are fortunate to have this hour, and Dr. Nicholas Shamma is a founding member of IVF Michigan Fertility Center. He is a pioneer in reproductive medicine and infertility. He has performed more than 8,000 IVF cases worldwide and has more than 150 publications in the field. And we are honored that he's with us today. Last time we were talking, we were trying to reel from the coronavirus lockdowns and how it affected us, and it seems like we're going into another one. Are you surprised that this is happening?
I mean, I am certainly not surprised. Most of the medical professionals in the field, Khalil, have anticipated what we call a second wave type of thing happening in the early winter and late fall. And the reason for that is obvious because, number one, coronavirus is still around, and people tend to forget sometimes. People tend to forget that. Sorry, I got a message at the same time. People tend to forget that there is coronavirus, and they get coronavirus fatigue to some degree, and therefore, all of the mitigating efforts that they ought to pursue and do in their personal lives and in their businesses tend to be forgotten or become relaxed, and to that end, the coronavirus expands in terms of transmission. And then the other reason is because of the cold weather, more people are spending time indoors as opposed to outdoors in gatherings and so on, and that actually also makes the coronavirus spreads within households and communities at a much faster rate than one would anticipate in the summertime. And the last reason is because of the weather. I mean, clearly the virus doesn't love temperatures, and high temperature in the summertime is definitely a concern for the virus. thank God for us. But then now we're in the cold weather, and the virus can sustain itself and live longer periods outside.
Is that
So
because
that's
of
why-
its composition?
It's actually most coronaviruses don't like hot weather or very hot weather. That doesn't mean that they don't exist, but to some degree, the rate of transmission and whether we're talking about aerosols or droplets in the air, because of the physics of the hot weather or the hot air, makes those viruses less likely to sustain themselves in the air, and therefore more likely to fall down to the ground as opposed to falling on another person that happens to be passing by nearby. So that's just physics related to air conditions.
Absolutely.
So for those
And,
reasons, I mean, there's more coronavirus, and there will be more coronavirus until we have the very effective vaccine. And it looks like we have a couple of initial reports, very preliminary reports, to suggest that there could be a very, very effective group of vaccines on the horizon. And I bet there were going to be. It could be just because of the fact that we learned how to deal with the virus, whereas in the initial few months of the pandemic, we didn't really know how to deal with it. The other reason is that it's probably affecting less, vulnerable populations now than it did before, because those vulnerable populations were not really ready and were not aware that there was a virus. We're talking about nursing homes. We're talking about elderly people still traveling, still going on cruises and whatnot. Now, all of those populations at risk with comorbid conditions realize that the virus actually affects them at a more severe rate than other people, and therefore those individuals are taking more precautions. And probably the third reason of why currently is the development of new therapeutics in dealing with COVID. And we're talking about monoclonal antibodies, and these are antibodies that are injected like what President Trump took in the first 24 hours after he was had symptoms. So all of those therapeutics tend to be helpful in mitigating some of the very, very serious and, God forbid, deathly effects of COVID-19. That not to minimize that does still happen, unfortunately, and it mostly happens to people that are older with comorbid conditions like hypertension, like diabetes, like kidney disease, like lung disease, and so on. So it is imperative for this group of people to take every precautionary measures. And just to reiterate what those measures are, we're talking about wearing face mask, eye protection if possible, social distancing, hand washing, hand sanitizing, and most importantly is to avoid gatherings. I mean, I can tell you from my personal office situation, and I have 9 offices in 2 states, is that most of the transmissions that have happened and are happening is not because of patients or staff or whatever. It's because employees and or patients and or people that come to the office in their personal lives have not taken adequate measures to prevent exposure, and therefore they were exposed and put everybody around them at risk. And people forget that when you're exposed, and maybe yourself are not going to die or become severely ill, but the person next to you, your loved one, your parent, your spouse might be somebody with comorbid conditions and might be elderly and might be at risk of having severe ramifications from COVID-19.
In regard to the vaccine, Doctor, in regard to the vaccine, there has been, and maybe these are people who are anti-vaccine, but there has been some concerns about the way this vaccine was developed, and there may be some concerns about risks and things like that. Are those a valid concern? Are those valid concerns, or they're just people on social media talking whatever they want to say?
Well, I mean, number one, let's answer the second part of the question. Social media is still the Wild West, where everybody, because we're a free country, can say whatever they want. If you're in China, you can't say whatever you want. So that answers the second part of the story, the question. The first part is, I mean, in medicine, there is no drug, none whatsoever, including water. I mean, there is not a single thing that we consume or get exposed to that doesn't have side effects. So to that end, that's something just to keep in the back of your mind when dealing with anything. But putting it in perspective, the vaccines that are being developed are being very rigorously tested, and whether we're talking about and there are different types of vaccine. There are RNA vaccines, there are protein-related vaccines, there are nanoparticle-related vaccines. There is even in the horizon, as of yesterday, a DNA vaccine that's also up and coming. So all of those vaccines are being tested rigorously, and eventually we will have a very safe, and it appears to be from the initial preliminary reports on both Moderna's vaccine and on Pfizer's vaccine, that they are highly effective. The question is, we don't know how long they are effective. So we don't know if they're effective for 6 months, for 4 months, because we haven't had time to test that, correct? We just know that in the immediate time frame after they've been deployed in those studies, that they were very, very effective in preventing COVID, symptomatology. And we'll have to wait and see. And there were going to be a lot of vaccines, and I want to assure people that the FDA will not give, they will not allow a vaccine to become commercialized and available unless it deems that it is safe. And when one weighs the risks of dying from COVID versus some minor side effects, if any, to any vaccine, well, there's no question that you take the vaccine. I mean, I haven't seen a single medical professional, whether a doctor or a nurse or whatnot, say, okay, I'm not going to take a vaccine even though there is one that is effective and prevents me from getting COVID. Not a single person I've ever talked to, or because that would be like insane.
Sounds good. I think it's just they're going to be available later. They may be available next month for medical professionals and first responders, and then they'll be available.
We don't know.
Actually,
we don't know who they're going to give it to. We don't know who they're going to give it to yet, Khalil. I mean, we have to wait and see what the government decides and how they're going to give it to the people at risk. The elderly people are going to give it to the people in the medical field. Who knows? But we'll have to wait and see. Yeah. But clearly, within the next 2 to 3 months, we will have one or more vaccines, and probably within the next half a year, we'll have 10 vaccines.
Sure. Now, that cocktail they gave President Trump, is that now available to everyone, or still experimental?
No, it's actually it was FDA approved as what we call EUA, emergency use authorization. So I mean, your doctor has to ask for it and apply for that emergency use, and then potentially can take it. The key is it's helpful mainly if you take it in the initial day or 2 or 3 after you get exposed. But and some people don't have the luxury of that, because a lot of times you stay at home in the first few days, and then that's a little bit too late.
Okay. We're going to take a short break. We'll be right back. Please stay with us now.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shamma is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shamma has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shamma is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shamma at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
سوا على الهوا سوا على طول سوا على الهوا يأتيكم عبر أثير إذاعة
صباح الخير أمريكا
من يوم اللي اتكون يا وطني الموج كنا سوا.
Welcome back, and thank you for being with us. We talked to Dr. Nicholas Shamma, and we started talking about the second wave, if you will, for the coronavirus. And the last question about this topic, Doctor, how have you adjusted at your practice in regard to and how you're preparing for the second wave, and hopefully there'll be no shutdown completely, but what should people expect if they're going to come and see you?
Well, I mean, we took the month of March where we put certain standard operating procedures in place, and those seem to be working to allow us to be able to deal with the situation that is current. And thank God all those measures so far have been effective in mitigating the risk. And these are recommendations from OSHA, from our Society of Assisted Reproduction, and from the American Society of Reproductive Medicine. So all of those things were put in place. And when you come to us, I mean, everybody is tested, actually. We don't do any procedures on anyone that has not had a COVID test. And coming to our lab, it says if you're going to a biohazard 4 laboratory, even the lights in our office have UV lights that when we're not in the office, they destroy the virus on anything. So, I mean, a lot of those steps we had to take, they were, and they are important measures, but those standard operating procedures allowed us to be able to mitigate as much as possible transmission and getting sick from the virus. So, I mean, we're going to be okay, God willing.
Sounds good. And we're going to start with the topic that we're going to talk about today, and the third-party donation. Mostly when people talking about donation, in the old days, most people used to think about sperm donation, but actually it involves a lot more than that. And there's an egg donation. There are other donations as well. And then when it comes to egg donations, I think we need to focus on the oocyte. And am I saying it correctly?
Yeah, I mean, the oocyte is just the medical terminology for the egg. So you can say egg, it's fine.
Okay. Is this where really it starts as the formation of the egg, or the life of the egg, and is that something that women are born with? Or do they develop later on in life?
Sure. No, I mean, here's the situation. Just to put this in perspective, third-party reproduction implies using more than two people to create one baby. So we're talking about using the genetic material from more than two individuals, which is the usual way where we do reproduce, where a husband and a wife, or a partner and a wife would have kids together through the genetic material of both of those parties. Third-party reproduction implies when you either use eggs that are not part of the couple that is the intended parents of the child, or sperm, or potentially use somebody else's uterus in case the uterus is not available, or the person that has the uterus cannot carry for whatever medical reason. So what we're going to talk about this morning, we should divide the topic into basically two parts. The sperm donation has been there for years and years and years, and I don't think we need to discuss it. And basically, it implies using donor sperm for people that don't have sperm, either husbands have zero sperm, or, to put it mildly, for women that are same-sex individuals that want to use sperm. So that's actually the easy part. And that has been there for the past 40 years or so. Now, the second part, which is what I think we should discuss today, and maybe for next month, just to give a preview of what we might discuss. So for today, we'll talk about oocyte donation, which is basically egg donation. And then next month, we'll talk about gestational surrogacy, which is when somebody else carries the pregnancy for the intended parents, in case the uterus, as I said, is not available, or in case the person that has the uterus, the mom, the intended mom, cannot, because of medical constraints, cannot carry the pregnancy herself. There is actually a social reason in that situation too, in case that there's like two gay men, for instance, that want to have a child, they have to have somebody else that carries the pregnancy for them. Now, to answer your question, the question of basically who, as far as the eggs are concerned, and how do women have eggs? Well, eggs start in utero. So a woman would have all her eggs created when she is or was actually in her mom's stomach at 20 weeks of gestation. And so when she is born, she basically has almost 1 to 2 million eggs available. And imagine this, before she even has her first period, she has lost almost 80% of them. So she only has around 300,000 eggs left somewhere around the age of 12, which is when they start having periods, women. And by the time that she is in menopause, then she has 0 eggs. So this is a very important fact. Each month, every woman, on the average, if you think about they're starting with, let's say, 300, 400,000 eggs and end up with 0, and they have 400 cycles between 12 and the age of 61, which is when menopause hits, a woman loses on the average 1,000 eggs every single month, whether she's pregnant, whether she's not pregnant, whether she's ovulating, whether she's not ovulating, around 1,000 eggs. And clearly, when you only have 10 eggs left at the age of, let's say, 50, you don't lose 1,000. So that's the average, but the amount of eggs lost is dependent really on the pool of eggs that you start with. So you lose a lot more when you're younger than when you're older and you're, let's say, 40 years of age and only has 10,000 eggs left. So that is a very important material reason, and one of the main 3 reasons of why women, intended parents, use donor eggs, which is that as they get older, their number of eggs diminish, and therefore they might not have enough eggs to be able to produce an egg that can be fertilized with their husband's sperm and so on, partner sperm, and therefore have to use eggs from somebody else. So that is the main reason, is women who have difficulty conceiving with their own eggs. The second reason why this is important, the issue of aging, is the issue of genetics. As women get older, not only the number of eggs that they have diminish, but the genetics of the eggs become compromised. So if you take women, for instance, at the age of 30 years of age, half of their eggs are not genetically normal. That is true for all women on the planet. If you take women at the age of 40, for instance, 75% of their eggs that remain are not genetically normal. And if you take women by the age of 45, 90 to 95% of all their eggs are not genetically normal. So that becomes a very material concern as women get older, or if their pool of eggs, even at a younger age, is lower than other women, is the effect of genetics. So women use donor eggs when they have difficulty conceiving with their own eggs. That's the first reason why women use donor eggs. The second reason go ahead.
What does it mean when they say genetically is not normal?
Well, as I'm sure you're aware of the fact that as women get older, when they have kids, those kids are at higher risk of having genetic disorders like Down syndromes, Edwards syndrome, Creutzfeldt syndrome, any of those genetic chromosomal syndrome. So those eggs are the reason why, even when pregnancy happens at an advanced reproductive age, why those women can have babies that are potentially born with major genetic disorders. And again, to put this in perspective, the chance of a 30-year-old having a baby with Down syndrome is around 1 in 1,000. At the age of 40, we're talking about 1 in 80 women will have a baby with Downs. So, dramatic difference. And again, because most genetically abnormal eggs don't develop, thank God, or get miscarried. But yet some of them do continue to develop into babies that are born. So that is the main reason why women use donor eggs, is because they can produce enough eggs or genetically normal eggs to be able to have their own biologic children. And
could women
go ahead.
Could women test their eggs to see if they are normal or not?
Yes, of course. Yes, of course.
Okay.
So here comes the interesting part, if you want to talk about it in this perspective, before we delve into how do we get a donor egg and what is the process that is involved in producing or getting donor eggs. When women get older, and we're talking about any woman above usually the age of 35 and so on, they can create embryos with in vitro fertilization. They can test the egg. The egg, Khalil, is basically one cell. So if you test it genetically, it dies. So what you have to do, you have to create embryos, correct?
Okay.
And can you hear me?
I can hear you better now. Yeah.
What I'm saying, you can test cannot test the egg, but you can test the embryo. The embryo, usually we're talking about a day 5 or day 6 embryo. So after the creation of the embryos, you can test those embryos by taking few cells out and do what we call pre-implantation genetic testing on the embryo, and send those few cells for genetic analysis, and then you can tell if the embryo is genetically normal or not. Here comes the problem.
Okay.
If you use a genetically normal embryo, whether you've taken it from a 45-year-old or a 25-year-old, if it is normal, it's normal, and the chance of pregnancy is exactly the same if you put it back into a normal uterus. However, the likelihood that you're going to get a genetically normal embryo from a 45-year-old is almost zero. So let me explain to you how it works. In a young woman, let's say that is 30, she'll produce around 15 eggs. Out of those 15 eggs, 12 of them will be mature. Out of those, somewhere around 9 of them will get fertilized. And out of those, half of them will turn out to be embryos that look good, and we're talking about around 4. And among those, half of them will be genetically normal because of what I just described. And if implantation rate is around 70%, at least in good centers, then you get your child from one cycle. That is genetically normal. But think about this. If you're 45 years of age and you only have 3 to 4 eggs that you produce, and if you do the math, 3 to 4 eggs, maybe 2 or 3 of them will get fertilized, but if 90% of the embryos generated from those eggs are genetically screwed up, then you're not going to have anything to put back for the women to become pregnant. So those are the groups of people that eventually utilize donor eggs, is because they cannot have enough embryos and generated that are genetically normal at the end of the day. Now, you might say, and I have patients that tell me this all the time, Khalid, who are you, Dr. Shamma, to tell us this? Why don't we keep trying? And I could be one of the patients that lucks out and does have a normal embryo at the end of the day. And we go along a lot of times. But at some point, the procedure and the process is emotionally draining, is expensive, is, to say the least. And therefore, to keep doing this over and over and over again for the hope of maybe producing an egg, even the likelihood of producing an embryo that is genetically normal is minute, becomes not a realistic option, correct? And therefore, to that end, they end up using donor eggs.
What we're going to do before we continue, Doctor, we're going to take a short break, and we'll come back and talk about freezing eggs and then the donation of eggs. Please stay tuned.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shamma is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shamma has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shamma is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shamma at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
سوا على الهوا سوا على الهوا يأتيكم عبر أثير إذاعة
صباح الخير أمريكا
من يوم اللي اتكون يا وطني الموج كنا سوا.
Welcome back, and thank you for being with us. This is Khalil Hashem. We're talking to Dr. Nicholas Shamma about egg donations and reproduction. Dr. Shamma is a renowned fertility specialist. Doctor, before we went on break, we were talking about the egg donation. Before we start talking about egg donation, is do certain women lose eggs faster than others? And should those women who are healthy freeze their eggs when they're young?
Yeah, well, I mean, let's answer that question. I mean, that sort of dovetails a little bit on the concept of oocyte donation, but clearly women lose eggs at different rates than other people, and we can assess ovarian reserve to that end by doing a blood test that can tell us how many eggs they have left. We cannot really, there's not a single test that looks at the rate of destruction of the eggs, but we can tell if somebody basically has low ovarian reserve, it means that they've destroyed their eggs at a faster rate than if they had more eggs available. So that's how we infer about the rate of egg loss. To that end, I strongly encourage all patients that are in their early 30s, we're talking about between 31 to 34 maybe, if they are not in a relationship and are not basically with child, to strongly consider oocyte freezing at that young age, because then I cannot tell you the regret that I see and the emotional distress that I see in some patients, because now they found somebody who they care about and they get married and so on, but then now they're 39, 40 or 41 and they want to use their eggs, and guess what? Either their ovarian reserve is low or the genetics plays a nasty, role on them, and therefore they end up not being able to produce embryos or eggs that they can utilize. So clearly my recommendation is anybody that can and is able to have their eggs cryopreserved at a younger age to be able to do that if they are not in a relationship and ready to have a child of their own. And that's what I told my daughter, but then she got pregnant on her own, and that was a good thing. So,
exactly. Now, how expensive is it to freeze eggs?
Well, it's the expense is somewhere around $10,000 to do that, and then there's a yearly fee to be able to keep the eggs frozen on a yearly basis, which is nominal. We're talking about a few $100s. But then the key is actually producing the eggs and freezing them from the initial time that patients do this, and the whole process is literally around 12 days, and the procedure is around 6 minutes. So it's really not complicated for the patient, and it's advised. And that if that happens to across the board or people that know about this, they can offset really hardship and heartache later on in life if they decide to delay childbearing to a later age, to an age where it becomes not feasible to utilize their own eggs.
Absolutely.
Now, just to finish on what we discussed before, Khalil, and put it in perspective, most people that use donor eggs have tried their own eggs before, and actually half of them, you do it at a younger age because they ran out of eggs, as you suggested. So half of the patients are less than 40 when they utilize donor eggs, at least in our field and in our practice, and we're the largest in Michigan and in the rest of the country. And so imagine half of them are less than 40, and most of them, I would say close to 50% of them would have done at least 2 in vitro fertilization cycles before they even decided or contemplated using donor eggs. Another 20% did 1 cycle. So we're talking 70 to 75% of them have done at least one IVF cycle to try to produce eggs of their own, but then they failed. And therefore, that becomes the main reason, as I said, to why women utilize donor eggs, whether they're older and it's obvious why they would, or if they're younger because they ran out of eggs at an accelerated rate. Or we didn't mention that the other reason why women use donor eggs is because they have a genetic condition and they don't want to pass it to the next generation. Then they could potentially use donor eggs. Now there's ways around this in case they can produce their own eggs sometimes, and those embryos can be tested for that genetic disorder, and that actually dissuades those women from using donor eggs. But then at the end of the day, if still they don't have enough eggs and they have a genetic disorder on top of it, the likelihood of anything material at the end of the day is small, and therefore they end up using donor eggs. And the third reason is obviously gay men, for instance, that want to have a family, they use donor eggs from somebody.
Okay. What's involved in egg donation?
All right. Actually, if I want to simplify it, the process is actually literally 5 steps. The first step is actually selecting a donor, and that's actually the biggest hurdle, in my opinion, is how do you select a donor? I mean, there are so many nuances to that, and we'll talk about it in a minute if you want. The second one is the donor therefore provides the eggs. The third process is the eggs get fertilized and the embryos get developed is the fourth thing. And finally, the embryo transfer is you take those embryos that develop from those donated eggs and you put them in a uterus that you have prepared, or we have prepared, to allow implantation to take place. So it's a 5-step process, but it is not as simple as I just described, and each one of those steps has a lot of nuances related to it. But in my opinion, the biggest hurdle to a third-party reproduction and for oocyte donation is actually the choice that is, and the decision to decide to use donor eggs, because that's not an easy decision. That is absolutely not an easy decision. And it involves on the patient's end a lot of work and acceptance, and on the physician, on the professionals in our field, a lot of work to make sure those eggs are actually literally good eggs and have been tested appropriately and so on. And by the way, all of this process is under FDA regulation. There is a law that was passed in Congress back in 2000 and early 2000, I would say. I don't remember the year, but it's called CFR 1271 subpart C, and that law governs how we deal with third-party reproduction, how we deal with oocyte donation, what testing we need to do, what evaluation of the donors we need to have to be able to use those eggs from those individuals. And clearly, we use eggs from younger women that have less likely have genetic concerns because of what we mentioned before, because they're young, and most of the donors are less than 30 years of age. But the key, as I said, is the choice that is made by the intended couple to use donor eggs. Because a lot of times when we introduce that to them, I mean, the patient feels, oh my God, I mean, Dr. Shamma probably overstepped his boundaries and maybe was not very compassionate to tell me that I need to use donor eggs and so on. But then when I will try to explain to them the facts and the likelihood of success and so on, a lot of people eventually are convinced that that's the way to go. But the choice, even after they make a decision, which donor do you use? Do you use fresh eggs? Do you use frozen eggs? Do you use, somebody who's ethnically related, religiously related to us? Do I use somebody that I know? Do I use a friend? Do I use a program? I mean, all of those are nuances that we can talk about now in terms of the choice of selecting a donor, which is the big thing.
Now, so how much of the genetics of the persons that are donating the eggs the child will carry?
All right. I mean, this is actually a very interesting question because it's not black and white. So let me explain to you what I mean.
Sure.
In the past, we used to think that if a person gets donor eggs, they get an egg from a genetically, different person, not their own eggs, and those eggs get fertilized by their husband's or partner's sperm, and the embryo, therefore, that becomes a baby at the end of the day, the embryo is not related to the mom that carries the pregnancy, correct? And the person that carries the pregnancy in this situation is the mom, but by every definition. So the thing is that is not completely true because of something called epigenetics. Let me tell you what I mean. Number one, let me start by this, that all of us humans, all men, for instance, you and me, are at least 99% exactly the same. Exactly the same. Only the 1% differences makes Khalil what he is and what makes me what I am. And the same thing for women. So we're all related because you go back 40,000 years, we all came from the same grandparents. And that's why for me, it's very hard to understand how come humans have wars and conflicts and so on. If they go back in history, they're all related. They're absolutely all of them related. So that end, I mean, if we're all 99% the same, I mean, if I show you two objects that are 99% the same, you can't tell the difference. True?
Yeah.
True,
absolutely.
So that's the first thing. The second, which is the epigenetic part of the story, is the following. Us humans, Khalid, are made up of around 20,000 genes. And those 20 to 25,000 genes. And those genes are either silenced or they are expressed in utero, what we call imprinted, meaning silenced in utero, based on not only the genetic makeup of the embryo itself, but on the environment that the intended mom in this situation, the mom that carries the pregnancy for 9 months, provides. So I cannot tell you the number of times that I've had, I do personally somewhere around 100 to 150 cases of oocyte donation per year. And I cannot tell you the number of times, Khalil, where the baby that is born looks like the mom that carried the pregnancy, even though I can tell you genetically, I used the donor egg. I didn't use the egg from the mom herself. And that's almost certainly partly maybe because they chose a donor that looks like them in terms of looks, but also because of probably epigenetic effects, which is what I just described. And this epigenetic notion is something that we have only recently become cognizant of in a situation like oocyte donation. Yeah.
Yeah. Now, when it comes to sperm, is different. Is that correct? The genetics that the child will have are related to the donor sperm, not to the father that is, or the partner that is there.
Well, yes, of course, because if you use donor sperm, us men, we don't carry babies. That's why all of us are more related to our moms than our dads, no matter how we spin it, us men. You and me. Because of the epigenetic issues that I just described. But if you use a sperm donor, then the sperm donor is the biological genetic provider of the genetic material for the baby and not the biological father. But any father that, myself included, of 6 kids, and you, I don't know how many kids you have, but God bless them. But we love our kids even though we don't carry them. And we love them.
Exactly.
I don't think at the end of the day genetics matters too much. It's the rearing of the kids. And let me tell you something about kids, having had all those kids over the years. Most of the time, 90% of the time, they're a pain. And it's only that 10% time that they give us, ultimate joy. But 90% of the time, they're in pain, most of those kids. And I don't know why we keep having them or want to have them. It's because of that 10%. It's because only of that 10%. So to that end, I can tell you that, whether who provides the genetic material for the sperm and or the egg is not that material in my view at the end of the day. Now, in certain cultures like ours, as Lebanese or Arabic cultures or Muslim cultures or Middle Eastern cultures, whatever you want to call it, in those cultures, sometimes our cultural and ethnic norms play tricks. Puts us at a disadvantage compared to more European-driven cultures because they're more accepting to third-party reproduction than ours.
Yes.
For obvious reasons.
Before we continue with this, we want to take a final break, and we'll be right back. Please stay tuned, Doctor.
Sure.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shamma is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shamma has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shamma is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shamma at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
على الهوا سوا على الهوا يأتيكم عبر أثير إذاعة
صباح الخير أمريكا
من يوم اللي اتكون يا وطني الموج كنا سوا.
Welcome back, and thank you for being with us. So we're going to continue our discussions with Dr. Shamma about third-party donations, and today we're focusing on egg donation. How common is that, Dr. Shamma? How common is egg donation?
Well, almost 10% of all assisted reproductive technology situations done in the United States use donor eggs currently in the United States. So we're talking, for us, out of the 1,200 or so procedures we do every year, probably somewhere around 150 utilize oocyte donation each and every single year. So, we're talking quite a bit. And maybe I think, Khalil, in the next few minutes that we have left, I think we should discuss a couple of issues that always come up. Number one, I want to assure the people that are listening to us that when we make the choice to use oocyte donation, us in the medical field will screen like 10 people to get one person that is ready to donate her eggs. And we screen them medically, we screen them socially, we screen them surgically, we screen them using blood tests that is required by the FDA. We actually do genetic analysis on them for almost 300 disorders and so on and so forth. So all of them are super screened, and only then would they be able to donate the eggs, and we'll use either fresh eggs or frozen eggs, and fresh eggs that are obtained from those people are a little bit higher success rate in terms of ultimately delivering a kid in the intended parent than frozen eggs. So that is one aspect I just want to address. The second one, which is important, that comes time and time again, is, in my opinion, what is the relationship between the donor-conceived children and their parents? And I want to assure all my listeners, having done this for the past 30 years, that the relationship is good. As they say in the State of the Union address, that the State of the Union is good, I hope, even despite Corona.
Yeah.
But the relationship is good. And there are studies that have shown this, and we've published on that, and other people have published. Two things that are interesting. Number one, early studies done in the first 3 years of life showed that the relationship of the intended moms, the moms that bore the children conceived from donor eggs, is exactly the same to their babies as women who conceive their own biological genetic children. But then there are studies that have been done in the UK where investigators have followed actually kids for almost 12 years of age. And they found out that there is absolutely no difference in every aspect, whether it's parent-child relationships, the parents' marital and psychological states to one another, and most importantly, the child's social and emotional development. So this is a very important piece of information and dovetails on what I'm going to tell you next, which is when and should you disclose to the kids that they're the product of a donor egg. I can tell you in our Arabic culture, that disclosure is not very common. You understand potentially why, because they don't want to tell anyone that they did donor eggs or whatnot.
Exactly.
Now,
Exactly.
the problem in my mind is what we call direct-to-consumer genetic testing. So what I'm trying to say is, with the advent of 23andMe and other companies that do direct-to-consumer genetic testing, a lot of kids born now eventually will do this type of test, or it becomes readily available to everyone, I guess, in years down the road, and they will figure out at the end of the day if their parents are indeed their genetic biological parents or not. So my advice is to actually disclose to the kids at the younger age. And studies have shown that the younger you disclose, the more likely that the kids will fare better than if they know at the age of 20 or 30 or whatever age. And it's interesting, most of the data still coming into the disclosure part of the story comes not from donor eggs, donor sperm, but comes from adoptees, kids that have been adopted by parents. And the issue is when those kids were told that they were actually adopted, not their biological children. And therefore, most of the time, the earlier you disclose to the kids that they're a product of some other, not biological event that involves both mom and dad, the better it is as far as the kid is concerned at the end of the day in accepting and dealing with this in a very appropriate manner.
Absolutely.
So that is
there anything,
the other part.
Yeah. Is there anything that I haven't asked you that people need to know in regard to this topic before we run out of time?
Well, before we sum it up, I think the important part of the story still is the choice. And why is it that certain ethnic groups, for instance, why is it that Arab Americans, or whether we're Muslim Americans, or why is it that those groups of people are not very accepting to the notion of oocyte donation? I cannot answer that. This probably has religious backgrounds, ethnic backgrounds, and so on. And therefore, in my opinion, the choice of using a donor egg is the big hurdle that those intended parents have to overcome. The other thing that we didn't discuss is that a lot of times I have patients that come in and say, I want to use my sister or my cousin or my relative or my friend or somebody that I know. I mean, that's actually potentially okay, but I have seen more problems from this than quote-unquote anonymous oocyte donation. And let me tell you what I mean.
Sure.
The advantage of using somebody that you know or a sister or whatnot is that you know that person, correct? And you know the background much more than what you know from a booklet or a website about who the person that provided the eggs, who she is, and so on. Now, the disadvantage, in my mind, is social. Because even though currently, let's say, whoever donates the egg to the other person has a good relationship with that person, sometime at the end of the day, that relationship might sour, correct?
Exactly.
And therefore, that creates a lot of ramifications down the road in terms of the kids or the children that are born from such oocyte donation. And therefore, in my mind, Khalil, sometimes it is riskier to use eggs from quote-unquote known donors or directed donation as opposed to anonymous donation. But I would say
Absolutely.
Still 10% of the time that is done. The other footnote to that is the following, that a lot of times when a woman is 40, she'll bring her sister who is 38 and say, okay, I would like to use my sister to provide the eggs. But then when the donor needs a donor, then we have a problem, correct?
Yeah.
So that is
Absolutely.
always something to consider when you use directed donation. Whereas if you use anonymous donation, well, all those donors are screened ahead of time, and all the donors usually are young and healthy and genetically okay as far as far as concerned. The other
we have 30 seconds left, Doctor.
I want to just sum it up before forget the last thing that I was going to address. But basically, oocyte donation is a beautiful thing that allows parents to become parents, intended parents to become parents. So at the end of the day, Khalil, it is something that ought to be discussed with the patient in a forthright manner, and it gives parents that are older, that have ran out of eggs, and so on, the option of raising children, having a family, with all the advantages, disadvantages of having a family. So to that end, it's something that we do, we help provide, and to that end, please, everybody, because of this COVID, just to end it the way we started, is be safe and do whatever measures you can to minimize COVID exposure.
Thank you so much, Doctor. As always, it has been the pleasure and honor talking to you, and we want to thank you for your time and this valuable information. And please be safe, and then we shall talk next month. Thank you so much.
Same to you, Khalil, and to all your listeners, and God bless you all. Bye.
Thank you. Bye now. Thanks for everybody for listening. Thank you, Mike, for producing, and talk to you later. Bye now.